Hello everyone. The next developmental disturbances of tongue that I'll discuss today, that is median rhomboid glossitis. Before discussing the anomaly, that is median rhomboid glossitis, I'll discuss briefly about the development of tongue. The tongue developed embryologically by two lateral swellings that meeting in the midline and fuse together above a central structure from the first and second pharyngeal arches, that is the tuberculum impart. The anterior two-thirds of the tongue is formed by two lingual swellings and one tuberculum impart, and the posterior one-third of the tongue is formed by the hypobranchial eminence. In this median rhomboid glossitis, the posterior dorsal point of fusion is defective. So, it leaving a rhomboid shape which is present at the posterior one-third of the tongue. So, basically the fusion is not occur properly. Because of the defect in the fusion, this lesion may occur. This median rhomboid glossitis is also known as central papillary atrophy, posterior lingual papillary atrophy, posterior midline atrophic candidiasis. The term posterior midline atrophic candidiasis has certain difficulties because not all the cases that improve with antifungal therapy, or the etiological factor, it may not always because of the fungal infection or show any initial evidence of fungal infection. So in this lesion, the posterior dorsal point of fusion is defective. It leaving a rhomboid shape at the posterior one-third of the tongue, and it appears smooth and erythematous, that is more red in color, and lacking filiform papilla or taste buds. In the picture you see there is a rhomboid shape and red in color which is present in the posterior one-third of the tongue. The erythematous or red coloration clinical appearance is due to absence of filiform papilla rather than it is because of a local inflammatory changes. It was first suggested in 1914 by Brock and Protrier. The lesion is found in one of every 300 to 2000 adults, and it is seldom biopsied unless the red discoloration which is confused with precancerous erythroplakia or its surface shows any pronounced nodularity. Because of its appearance, it is more red in color, so it may be confused with erythroplakia or the premalignancy. To rule out any precancer, it is sent for biopsy. Then the clinical features of median rhomboid glossitis. It presents in the posterior midline of the dorsum of the tongue, just anterior to the V-shaped grouping of the circumvallate papilla. The oval area or the depapillation is in the antero-posterior direction, and males are more commonly affected as compared to the females. Those lesions with atrophic candidiasis are usually more erythematous but respond with excess keratin production, and it show a white surface change. In atrophic candidiasis, there is a loss of filiform papilla, there is increase in red color. But with keratin production, because of keratin deposition, there is a surface change, there is a color change, and it appears white in color. Sometimes the infected cases, it may also demonstrate a midline soft palatal erythema, as well as there is a erythema which is present on the tongue lesion, posterior part of the tongue, and they contact with each other and refer to as kissing lesion. The palatal lesion which contact with the tongue lesion, that is known as kissing lesion. These lesions are typically less than 2 cm in the greatest dimension and the surface is smooth and flat. Then the differential diagnosis of median rhomboid glossitis: gamma of tertiary syphilis, granuloma of tuberculosis, deep fungal infections and granular cell tumor. These lesions may mimic the median rhomboid glossitis. Then histopathological features, what you see under the microscope. Median rhomboid glossitis shows a smooth or nodular surface which is covered by atrophic stratified squamous epithelium which is overlying a moderately fibrosed stroma with somewhat dilated capillaries. Fungiform or filiform papilla, they are not seen. There is basically absence or loss of papillae. A mild to moderately intense chronic inflammatory cell infiltrate may be seen within the subepithelial and deeper fibrovascular tissue. Then there is a dyskeratosis, that is individual cell keratinization. Then it is because of chronic candidal infection that may result in excess surface keratin or extreme elongation of retapex. And there is a premature keratin production with individual cells which is known as dyskeratosis. Silver staining for fungus will often reveal candidal hyphae and spores in the superficial layers of the epithelium. And this pseudoepitheliomatous hyperplasia, it may be quite pronounced, and this pseudoepitheliomatous hyperplasia occurs because of tangential cutting of such tissue specimen that may result in the artifactual appearance and of the cut rete as unconnected islands of squamous epithelium, and it leading to a mistaken diagnosis of well-differentiated squamous cell carcinoma. Because of this difficulty, it is recommended that the patient should be treated with topical antifungals first prior to the biopsy of a suspected median rhomboid glossitis. Okay. In the picture you see, in the histopathological picture, there is candidal hyphae which is present. It is hematoxylin and eosin stain. Coming to treatment plan for median rhomboid glossitis, there is no treatment is necessary, but nodular cases are removed for microscopic evaluation after the biopsy. Then recurrence after removal is not expected, although those cases with pseudoepitheliomatous hyperplasia, it should be followed closely for at least a year after biopsy to be certain of the benign diagnosis. Then another treatment plan, if it is due to any fungal infection, then patients should follow the antifungal therapy. It can be topical medication or systemic medication that will reduce the clinical erythema and inflammation due to candidal infection. And some lesions, they will disappear entirely after the antifungal therapy. So these are all about the median rhomboid glossitis, the clinical features and what are the treatment plan and what are the histological features of median rhomboid glossitis. Hope you like this video. Please like, share and subscribe to this channel for upcoming new videos. Thank you so much.